Hello, I'm Dr. Brandt Gibson, and I'm excited to talk to you today about tendon tears. Now, that's kind of an interesting subject, right? But we have so many tendons in our bodies, and I'm going to focus more on the lower extremity, of course, because there's multiple tendons that we actually worry about, multiple tendons that we run into here. So as you look at this model here, you're going to have tendons out in the front. Of course, you have the Achilles tendon in the back, and you have tendons that are going around the ankles, both the top of the foot, bottom of the foot, all different areas where you're going to actually have tendons. And what the tendon is designed to do is cause motion from a muscle across the joint. And so it's going to be, tendons go from a muscle to a bone, so they can cause motion across the joint and cause the foot or ankle or even hands and feet and all that kind of stuff to move the way you want them to move. And these tendons are very, very valuable. The problem is you can injure a tendon just like anything else. And there's multiple different things you can do to a tendon when you injure. You can actually sprain it or strain it. In the case of the muscle, you can actually strain a muscle. You can actually strain a tendon where the tendon hurts and it's just swollen around it. You can get a tendonitis where it's just an inflammation of that tendon. But the big issues is if you get a tendon tear. Now, there's multiple different types of tears that you can do. You can get a tendon tear where it's just a complete tear, where it's tear through the tendon. You got complete separation. You got two pieces of the tendon that are separate. And truthfully, if it comes down to that being the problem, the best treatment is to bring them back together and repair them, whether that's through surgery or through certain types of casting or splitting or whatever. You're going to get it to the point where the tendons can repair or pull back together. Number two is longitudinal tears. So instead of being a cross-sectional tear where the tendon is completely separate, you've got longitudinal tears that can be pretty significant, but they go down the length of the tendon. So instead of being a single tendon, it's now being split because of that longitudinal tear. Those can be just as painful, just as problematic, although you still often will have motion and so forth. And a lot of times those likewise need to be repaired in some way, whether that's from limiting motion completely so it can try to repair itself, or you go in and actually suture it back together and sew it back together, make it work like it's supposed to. So tendon tears, so longitudinal tears, complete transection, and then you can have partial tears where they're partial transection or a portion of the tendon is just detached. And again, whether you need to get them to repair, whether it's self-repair by splitting or casting or whatever, or surgical repair. Most of the time, if you have a pretty significant tear in the tendon, I recommend that you treat it with surgery, where you go in and actually physically repair the tendon, because you're going to get back faster and you're going to have less problems that way if you do that. So tendon tears, if it's little tiny tears, you can actually allow them to recover, decrease motion, putting in a boot, something like cast, something like that. Or if it's pretty significant tears, you should repair it. If it's multiple tears, a lot of times you need to repair it. If the treatments you're doing aren't making it better, again, it's worth getting in and doing surgery and repairing the tears and so forth that you're seeing. So how do you know if it's torn? Symptoms, of course, is one of the reasons, one of the ways. Number two would be ultrasound. You can actually look at a tendon and say, okay, is there anything going on? And of course, MRI will be give you a pretty significant amount of how much tear and how much swelling and so forth. So you can evaluate it and you can treat it. But if you have a tendon tear, it needs to be treated in some way so that your body can actually recover. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 376, tendon tears and things that you can do for it. If you'd like additional information, if you can reach out to us at utahfootdoc.com, we will get you the information you want and hopefully give you the help that you want so that you can continue to live your life the way you'd like to live it. So have a great rest of your day. We will talk